Tell us what exactly a CHOW or a health navigator does.
Sure, our CHOWs, our community health outreach workers, and our health navigators work together to assist our members who have fallen out of care or our members who are not even connected to care. We conduct a thorough needs assessment once we locate them, and based on this needs assessment, we're able to see what barriers may be preventing them from accessing medical services. And it's our job to help them navigate complex medical systems, to help them find resources so they can overcome these barriers and obstacles, and help them get into care and, most importantly, stay in care.
So, you and your team identify barriers to care. What's the next step?
Our next step, once our team identifies the barriers, is to come up with a plan of action. So the team comes together for a meeting of the minds, and our team consists of our health navigators who are trained in motivational interviewing techniques. We also have registered nurses on our team, and also our CHOWs who offer peer support. So our goal is to get the member connected to community-based resources, to address the barriers, and get them connected to healthcare.
You usually don't hear the phrase insurance plan combined in the same sentence with community outreach. Did that combo surprise you at AmitaCare?
When I learned about the position of a health navigator and the work that a health navigator does, I just assumed it was going to be housed in a community-based organization. And I was really surprised when I learned that it was an insurance plan, a managed care plan offering this service. And it never fails. Whenever I am out in the community trying to find a member, when I knock on that door and tell them I'm from their insurance plan, they are very surprised, pleasantly so, that we offer this service.
So, what's the best part of your job?
I think the best part of my job is when someone tells me they don't need me anymore. For example, I was working with one of our members for over a year, and he had hypertension, he was diabetic, chronic leg pain, an intense fear of needles, and we worked really hard to get him connected back into care. So one day I called him to let him know when his next appointment was and let him know that I would be escorting him, and he said to me, "I don't need you anymore, youngster. That needle doesn't hurt anymore." And that knowing that this person can self-regulate, self-manage their care, that's the best part of my job.
Why do you feel these programs are needed at plans like AmitaCare?
Well, I think these programs are needed for many different reasons. Without a doubt, we know that people who are connected to care and retained in care, that it saves money, it's cost effective. But that's not what drives us. It's not what drives a health navigator or an outreach worker. For us, it's important for people to take an interest in their medical care because you see that they take an interest in their whole being. You see that their self-esteem really boosts, and it really transcends so many parts of their lives. And it gives people a voice. Programs like this gives people a voice, and I feel that's very important.